I'm Dr. Jeff Gelblum, Senior Neurology attending at First Choice Neurology. I'm a partner in First Choice Neurology, and I'm a very active participant in the NDAI neurology data platform. NeuroDiscovery AI is the world's largest repository of neurology clinical data. NeuroDiscovery AI basically takes the information that I have in my EMR system, my electronic medical record, as well as the records of hundreds of neurologists around the country, puts all that data together so that anyone doing research or learning about real-world outcomes can access the NDAI registry and learn more about patient outcomes in any neurology treatment space. NDAI is so important, particularly from a research perspective, because if one is doing clinical research, let's say one is doing a phase 3 FDA clinically sponsored trial, in that setting, let's say in the MS space, you want to find females between the age of 30 and 50 with 3 or fewer MRI lesions with cognitive deficiency. That cohort might take many months to a couple of years to coalesce in order to do a meaningful clinical trial with enough patients in it to achieve statistical significance. NDAI can generate that cohort in literally minutes. So a study that could have taken previously 3 years maybe take only 6 months. So it's important for speedy neurological evaluation, neurological research, so that folks can go in and look at clinical data in real time with quick access. The people behind NDAI are real-world neurologists like myself who have participated in this platform to make our data accessible to this giant data bank of neurology patients. With that, all of our EMR data, everything that sits in my computer here regarding patients, is deposited into the NDAI master data bank. Obviously, all of that information is sanitized so that no patient identities are ever out there, so they're not part of it. The information is sanitized and scrubbed, but the clinical stuff, the clinical data is all in there so that anybody wishing to get real-world outcomes, identify a specific clinical cohort in a defined disease state, all of that information is right here in the NDAI repository with easy access. NDAI is located here in the United States. The software management and development is US grown, local based. So with that, all of this information stays onshore, and the security of NDAI is paramount so that there can be no data breaches, no leaks, nothing to expose any patient identity, any patient identification, nothing of that sort. It is entirely anonymous from a patient data perspective, but enormous in terms of the amount of data that we've got. We've got over 5 million lives of neurology patient data, 5 million neurology lives in our database. NDAI is relatively new to the data game. NDAI has been around only for 2 years, established in 2024. But over these past 2 years, growth has been monumental. Right now, we've got several contracts with large pharma companies, people doing clinical research, everyone who's in the area of looking at real-world neurology data, outcomes, response to treatment, etc. Right at the end of this little presentation, you'll have a big screen pop up. Please feel free to access the contact information on that screen, email, call, and obviously someone from NDAI will get back to you. We are very interested in engaging with pharmaceutical companies, anyone looking at real-world clinical outcome research as it relates to the neurology space. NDAI is basically your tool if you are doing clinical research and want to see a large group of patients and how they respond to treatment, biomarker confirmation, all the things that go into furthering neurological care, treatment, and research. That's the goal of NDAI, to enhance research, to enhance outcomes, to allow all of us in the neurology treatment space better opportunities to treat our patients.